Hello everyone. In this lecture, we are going to discuss about different diagnostic investigations related to genitourinary system and nursing consideration for those investigations. Okay, first of all, we go with laboratory studies. Common laboratory studies pertaining to renal and urologic disorders include blood and urinary excretion test for renal function, prostate-specific antigen test, PSA, and urinalysis. Test of renal function. Renal function tests are usually used to determine effectiveness of kidneys' excretory function and to evaluate the severity of kidney disease and to follow the patient's progress as well. If a patient is admitted in hospital with problems related to renal system, then we can perform this investigation so as to follow the patient progress as well. And there is no single test of renal function. Best results are obtained by combining a number of clinical tests. And renal function is variable from time to time as well, and from laboratory to laboratory. So the renal function may be within the normal limit until about 50% of renal function has been lost. So for different diagnostic investigation in renal function, we go through the nurse and patient care consideration here. The test is renal concentration test. Here we can see the specific gravity and osmolarity of urine. Specific gravity is the test which tests the ability to concentrate solutes in the urine. And here the test protocol is fluid may be withheld for 12 to 24 hours to evaluate the concentrating ability of the tubules under controlled condition. A specific gravity measurement of urine are taken for a specific time to determine the urine concentration. And next one is osmolarity of urine. The concentration ability is lost early in the kidney disease. Hence, this test detects the early defect in renal function. And next one is creatinine clearance. Creatinine clearance provides the reasonable approximation of rate of glomerular filtration, measures the volume of blood cleared of creatinine in 1 minute. It is most sensitive indication of early renal disease, useful to follow progress of patient renal status. And we can obtain sample of blood serum for performing creatinine clearance. Serum urea nitrogen, blood urea nitrogen, BUN. It serves as an index of renal excretory capacity, and serum urea nitrogen depends on the body's urea production and on urine flow. It is affected by protein intake, tissue breakdown. For this also, we have to obtain sample of blood serum. Next one is protein. Random specimen may be affected by dietary protein intake. Proteinuria is regarded if protein is more than 150 mg in 24 hours. Urine collection test. For this test, we have to collect all the urine over 24 hours period. Next one is microalbumin creatinine ratio. It is the sensitive test for subsequent development of proteinuria. If the level is more than 30 mcg per microgram mg, creatinine predicts early nephropathy. For this, we have to collect the random urine specimen. The next one is urine cast. It is the mucoprotein and other substance present in the renal inflammation, and it helps to identify the type of renal disease. For example, red cell cast present in glomerulonephritis, fatty cast are present in nephrotic syndrome, white cast are present in pyelonephritis. For this also, random collection of urine specimen is done. Next one is prostate-specific antigen test. It is the amino acid glycoprotein that is measured in serum by a simple blood test. And if PSA is elevated, it indicates prostate disease. But if it is less than Now, 4 nanogram per ml, it is regarded as normal PSA level. If it is less than 10 nanogram per ml, it is indicative of BPS, that is benign prostatic hyperplasia. And if it is more than that, it may indicate prostate cancer. Here, the nursing and patient care consideration are patient preparation is not necessary. Some clinicians refer not to perform the digital rectal examination before PSA examination. Clinical laboratories may differ slightly in method used for determining PSA. So patient having serial PSA should be sent to the same laboratory. Next one is urinalysis. It involves the examination of urine for overall characteristics, including appearance, pH, specific gravity, osmolarity, as well as microscopic evaluation for presence of normal and abnormal cells. For the normal condition, appearance of normal urine is clear. And if the appearance seems cloudy urine, then it may always not be pathologic, but it can be related to some condition as well, like precipitation of phosphate in alkaline urine. Normal urine may also develop cloudiness if we refrigerate it or if we keep it at room temperature for long duration. And abnormally cloudy urine may also be due to the presence of pus, which is called pyuria, due to blood, epithelial cells, bacteria, fat, colloidal particles, phosphate, and lymph fluid, which is called chyuria. And the normal odor of urine is faint or aromatic odor. And the cloudy urine with ammonia odor may um, suggest urea splitting bacteria such as proteus causing UTIs. And offensive odor may indicate bacterial growth, presence of pus. The color shows the degree of concentration and depend on the amount of voided. Normal urine is clear yellow or amber color because of pigment urochrome. And dilute urine is straw colored. Concentrated urine is highly colored, and it is the sign of insufficient fluid intake. And cloudy and smoky colored urine may be from hematuria, spermatozoa, prostatic fluid, fat droplets, and chyle. And red and brown urine may be due to the blood pigments, porphyria, transfusion reaction, bleeding lesions in genital tract, and some drugs and food may also cause the discoloration of the urine. For example, some drugs like rifampicin and foods like beets may cause urine to be red. Yellow brown or green brown may reveal the obstructive lesion of bile duct system or obstructive jaundice, and dark brown or black due to malignant melanoma and leukemia. The pH of the urine reflects the ability of kidney to maintain the normal hydrogen and iron concentration in plasma and extracellular fluid. It indicates acidity or alkalinity of the urine, and pH should be measured in fresh urine. Otherwise, there will be changes from breakdown of the urine to ammonia, and the urine may become alkaline. Normal pH is around 6, which is normally acidic, and may normally vary from 4.6 to 7.5. And urine acidity or alkalinity has relatively little clinical significance. Specific gravity, it reflects the kidney's ability to concentrate or dilute urine, and it may reflect the degree of hydration and dehydration as well. Normally, specific gravity ranges from 1.005 to 1.025, and in chronic renal patient, specific gravity is fixed at 1.010. And if person is eating a normal diet, inability to concentrate or dilute urine indicates disease. And next one is osmolarity. And osmolarity is an indication of the amount of osmotically active particles in urine, and it is similar to specific gravity, but it is considered more precise test, and it is also easy. Only 1 to 2 ml of urine are required, and average value is 300 to 1090 millimole per kg, milliosmol per kg in females, and 390 to 1090 milliosmol per kg in males. Now, the nursing and patient care consideration for urinalysis are: fresh boiled urine is provided for the best result, and usually first morning specimen is required, and we have to obtain the sample for about 30 ml. And urine culture and sensitivity tests are typically performed using the same specimen. And if we are going to conduct urine culture, then we have to obtain the urine that should be clean catch urine. Or catheterization technique can be obtained, and patient with urinary diversion, especially ileal conduct diversion, require special technique to obtain the urine. We have to maintain completely sterile technique, and we should not contaminate with the bacteria from the intestinal diversion. Now the next one is radiology and imaging. These tests include the simple X-rays, X-ray with the use of contrast medias, ultrasound, nuclear scan, and imaging through computed tomography, scanning, and magnetic resonance imaging, that is MRI. And first of all, we go through X-ray of kidney, ureter, and bladder, which is also called KUB X-ray. It consists of plain film of the abdomen, and it delineates the size, shape, and position of kidney. It reveals the deviations such as calcification, stones, which we also called hydronephrosis, cyst, tumors, or kidney displacement. Okay, we can here see the X-ray imaging view of KUB X-ray. Here is the bladder, kidney, transverse process of lumbar vertebra, and Swas shadow. This is the Swas shadow. Okay, now what are the nursing consideration? Here also no preparation is needed. Usually it is done before other testing, and patient will be asked to wear gown and remove all the metals from the X-ray film. Next one is intravenous pyelogram or intravenous urogram. IV introduction of radio-opaque contrast medium that concentrate in the urine and thus facilitate the visualization of kidney, ureter, and bladder. The contrast medium is cleared from the bloodstream by renal excretion later on. And for this, nursing consideration are: we have to be sure that the patient should not be of renal failure, uncontrolled diabetes, or multiple myeloma. They are contraindicated. And it is also contraindicated in patient receiving drug therapy for chronic bronchitis, emphysema, asthma, and in patient taking metformin, glycophage, diabetic patient, and patient with known iodine contrast material allergy as well. And while preparation is necessary here, we have to provide clear liquid only the day before examination, and laxatives are given the evening before examination so as to clear the bowel tract, and nothing by mouth, NPO, nil for oral, after midnight the day of examination. Next one is retrograde pyelography. And it is the injection of opaque material through the uretral catheter, which have been passed up to uterus into the renal pelvis by the means of cystoscopic manipulation. And the opaque solution is introduced by the gravity or syringe injection, and it may be done when intravenous pyelography is contraindicated or IVP provides inadequate visualization of the collecting systems. And here the nursing consideration are: we have to contraindicate in patient with UTI, which may spread or the infection, and or with suspected perforation of ureter or bladder. Allergic reactions to contrast materials are rare in this examination. We can see here the figure how the dye is injected through vein and X-rays are taken, and we can see here the imaging view. Next one is cytouretrogram, which it is the visualization of urethra and bladder by X-ray after retrograde installation of contrast material through a catheter. An examination of only bladder is called cytogram, and if urethra is examined, then it is called urethrogram. And it is used to identify the injuries, tumors, and structural abnormalities of urethra or bladder, or to evaluate the emptying problems, voiding problems, emptying problems, or incontinence. And we can also perform the voiding cytourethrogram. And during this diagnostic investigation, the investigation will be performed during the patient is voiding or maturating. The nursing consideration for this diagnostic investigation is that it carries the risk of infection due to instrumentation, so we have to be careful in this. Allergy to contrast material is usually not a contraindication, and additional x-rays may be taken after catheter is removed and patient voids. And we have to provide reassurance to allay the patient embarrassment. Next one is renal angiography. It is the diagnostic procedure where IV catheter is threaded through the femoral or the iliac arteries into the aorta or renal artery, and contrast material is injected to visualize the renal arterial supply. And it evaluates the blood flow dynamics, demonstrate abnormal vasculature, differentiate renal cysts from renal tumors as well. And it may also be done to embolize the kidney before nephrectomy for the renal tumor. Okay, we can here see the imaging study of angiography. And here we can see the renal artery stenosis. The artery size has been decreased here. It has been decreased comparatively to the left and right side of the arteries, which can be visualized through renal angiography. Okay, nursing consideration for this diagnostic investigation is we have to provide only the clear liquid after midnight before examination. Adequate hydration is essential, and we have to continue the oral medications if special orals are needed for example, like in diabetic patient, and IV access is required. And it may not be done on the same day as other studies requiring barium or contrast material is done. And we have to maintain the bed rest for 8 hours after examination with leg kept straight on the side used for groin access. And we have to observe frequently for hematoma or bleeding at the access site. And we can also keep sandbags at the bedside for use if bleeding occurs. Next one is renal scan. It is the radiopharmaceutical test. Here the radiopharmaceuticals are, which are also called the radio tracers or the isotopes, are injected IV for the clear anatomical visualization. It helps to evaluate the renal size, set position and function, or the blood flow to kidney, and studies are obtained with the scintillation cameras, which are placed posterior to the kidney with patient in supine or either prone or either sitting position. And the nursing consideration for this investigation is that patients should be well hydrated. Several glasses of water should be given orally, or if it is contraindicated, we can give IV fluid as ordered before the scan. And furosemide, which is the diuretics, we call it Lasix, and or captopril may be administered in conjunction with the scan to determine their effect as well. And next one is ultrasound. Ultrasound, it is a non-invasive diagnostic procedure which uses the high frequency sound wave and which pass into the body and reflects back in the varying frequencies based on the composition of soft tissue. And the organs in urinary system create characteristic ultrasonic images that are electronically processed and displayed as an image. Abnormalities such as mass, malformation, obstruction can be identified. It is useful in differentiating between solid and fluid field masses as well, and it is non-invasive technique which I have already mentioned. Nursing consideration for this investigation is that if it is the ultrasound of prostate, then It is performed by using a rectal probe, and a fleet enema may be ordered just within an hour of examination so as to clear the bowel tract, colon. An ultrasound examination of bladder requires that the bladder should be full. So we have to advise the patient to take plenty of fluid and stop the urine. And patient should not have had any studies using the barium for 2 days before ultrasound of kidney or bladder. Next, CT scan and MRI we have already studied in the previous class in cardiovascular system. So we will not go in detail here. You have to refer the previous notes for this. So we go through the other test now. Other test may be done. Other tests that may be done to evaluate the disorder of renal and urologic system include cystoscopy, urodynamic testing, and needle biopsy of kidney. Cystoscopy is the method of direct visualization of urethra and the bladder by means of cystoscope. It is an instrument and that is inserted through the urethra into the bladder, and it has a self-contained optical lens system that provide a magnified, illuminated, that is the clear view of bladder. Okay, we can see here in the picture. This is the cystoscope, urinary bladder and tumor or stone removal. Here the examiner is viewing the bladder. We can see here in the picture. Okay, this is used to inspect the bladder wall directly for the tumor, stone, ulcer, and to inspect the urethra for abnormal or to assess the degree of prostatic obstruction. And to allow the insertion of urethral catheter as well, we can use cystoscope. And for radiographic studies or for abdominal and GU surgeries, and to see the configuration and position of urethral orifice, to remove the calculi from urethra, bladder, and ureter, and to diagnose and treat the lesion of bladder, urethra, and prostate. Okay, the nursing consideration for this investigation is the simple cystoscopy can be performed, usually performed in office setting, that is in the bedside setting. Also, we can perform this investigation, but if it is complicated and if resections are involved, if urethral catheter had to be inserted, then we have to do in the OT room because sedation and general anesthesia may be required. And the patient's genitalia are cleaned with antiseptic solution just before the examination. We can also use the topical anesthetic, like we use Xylocan gel in practice, and it is instilled into the urethra before insertion of cystoscope. And because the fluid continuously flows through the cystoscope, patient may feel an urge to urinate during the examination. We have to clearly explain this to the patient, and if the patient is a known case of UTI, it is contraindicated in the patient. Okay, after cystoscopic examination, we have to monitor for complication, urinary retention, urinary tract hemorrhage, infection with prostate or bladder, and expect that the patient may have some burning, unvoiding, blood tingled urine, and urinary frequency from trauma to the mucous membrane of urethra. And we have to administer or teach the self-administration of antibiotic prophylactic as ordered so as to prevent UTI. We can also advise seize bath and provide routine catheter care. And next one is urodynamics. And urodynamics is a term that refers to any of the following tests. Here are a number of tests we will be discussing through. First one is uroflowmetry, and it is the record of volume of urine passing through the urethra per unit of time, ml per second. And the result will be shown on the graph paper. Next one is cystometrogram. It is recording of the pressure that is exerted during the filling and emptying of urinary bladder. Next one is sphincter electromyelogram, which measure the activity of the pelvic floor muscles during bladder filling and emptying. Next one is pressure flow studies, and this involves all of the above which I have mentioned earlier, along with stimulation measurement of intra-abdominal pressure by way of a small tube with a fluid-filled balloon that is placed in the rectum. and it permits the better interpretation of actual bladder pressure without the influence of intra-abdominal pressure. And next one is video urodynamics. It is also use all of the above components along with the fluid is used to fill the bladder in. The fluid that is used to fill the bladder is contact material, and the entire study is performed under the fluoroscopy. The difference is that much. And video urodynamics are reserved for patients with complicated voiding dysfunction. Nursing consideration for this investigation are: it is contraindicated in UTI, it is frequently performed by nurses, so essential to provide the information and support throughout the test to ensure clinically significant result. Patient will having burning on micturition afterward due to instrumentation, so we have to encourage fluid intake, and certain antibiotics are commonly given to prevent infections. And finally, we come to needle biopsy of kidney. This is the last diagnostic investigation we are going to discuss here. It is performed by percutaneous needle biopsy through renal tissue with a ultrasound guided, or by open biopsy through a small flank incision, useful in securing the specimen for electron and immunofluorescence microscopy to determine diagnosis, treatment, and prognosis of renal disease. We can see here in the picture. The fine needle is taken for taking the tissue out, and this is the ultrasound probe, ultrasound guided biopsy. This is a picture of ultrasound guided biopsy. This is the probe of ultrasound here. Okay, the nursing consideration pre-biopsy are: we have to ensure that coagulation studies are carried out. We have to ensure the patient fast, that is, patient should be NPO several hours before the procedure as ordered, and we have to establish an IV line. We have to describe the procedure completely to the patient, including patient has to hold the breath to prevent the movement of thorax, and during the insertion of biopsy needle, and it will be probably for short duration. And post biopsy nursing management are: we have to place the patient in prone position immediately after the biopsy on bed rest for 8 to 24 hours so as to minimize bleeding. We have to take vital signs every 5 to 15 minutes for first hours, then after half an hourly for next hour, then hourly. Then we have to watch for the rise and fall of blood pressure, vitals, and other complications related to hematoma formation and all. And we have to collect the serial urine specimen so as to evaluate the hematuria also. We have to assess for the patient complaint, especially frequency and urgency of urine, because there might be complication. We have to keep fluid intake at 3000 ml per daily if patient tolerates, and check the results of hematocrit and hemoglobin as well through blood test. We can do this on following morning. And we have to prepare for transfusion and surgical intervention if the complication extends and we cannot control the hemorrhage, and which may necessitate the surgical drainage or nephrectomy as well. Okay, following after the biopsy, we have to instruct something to patient, and that are we have to advise them to avoid the strenuous activity like sports, heavy lifting for at least 2 weeks, and notify the healthcare provider if any of the following occurs. For example, flank pain, hematuria, lightedness and fainting, rapid pulse, and other sign and symptom of bleeding, because this may be the sign and symptom of complication. And we have to report for follow-up 1 to 2 months after the biopsy. And the physician or the healthcare provider will check for hypertension, and the biopsy area is ausculted for any bruit. Okay, thank you everyone. This was all about the diagnostic investigation related to genitourinary system. And in the next lecture, we will be discussing about the disease condition related to genitourinary system. And if you have any queries related to this lecture, you can message me in the message box, or you can ask me personally. Thank you for listening.